1 in 6 American men will be diagnosed with prostate cancer during his lifetime. 1 in 6. To me, that's a startling number. However, the good news is that the majority of men will be diagnosed during its early stages. But in order to receive an early diagnosis, men have to watch for warning signs and receive regular testing. Here to share more information on battling this disease is Dr. Joel Fisher, a urologist with Somerset Medical Center and director of the Prostate Cancer Institute at Steeplechase Cancer Center. Welcome, Doctor.
Thank you, Meredith.
Thank you for being here.
My pleasure. Happy to be here.
Well, tell me a little bit about prostate cancer.
Well, prostate cancer is the most commonly diagnosed malignant tumor in older men aside from skin cancer, as you mentioned earlier. And approximately 220,000 men in this country were diagnosed in 2007, and about 27,000 men died of prostate cancer in 2007.
Well, it only seems like we've heard about it in the last decade. Why is that? Why has awareness increased?
Well, that's a good question. Obviously, it's been around much longer than that. But in the late 80s and early 90s, the PSA blood test became available. That stands for prostate-specific antigen. And through that, we became much better at detecting prostate cancer early and diagnosing it at earlier stages. So I think the word got out that it's very common. A lot of men were being diagnosed with it. There was a lot of media, and the awareness just really mushroomed.
Since we had the test introduced, the death rate has gone down from prostate cancer.
That's correct, because with the use of the PSA blood test and more regular and early screening, we're diagnosing prostate cancer at much earlier stages before it gets to advanced, and that's where it has the highest chance of being cured.
Well, how curable is prostate cancer?
Well, when prostate cancer is caught at its early stages, it's highly curable. The prostate gland sits at the base of the urinary bladder. It's involved in reproduction, and once we're done having children, unfortunately, we don't need it anymore, but it stays around to cause problems as men get older. Prostate cancer arises from the glandular tissue of the prostate gland. And when it is confined within the gland itself, that's considered localized. And it's those cancers that are localized that are really most amenable to being cured. Once the cancer starts to grow through the capsule or into the base of the bladder or spreads to other parts of the body through the lymph stream or the blood, then it is no longer so easy to treat.
What is the age and background of men who should be going to screenings?
Okay, well, there are certain risk factors for prostate cancer, and that's important in deciding who should be screened, for one thing. First of all, age, okay? Prostate cancer increases in risk as you get older. We recommend that most men starting around the age of 50 start getting annual prostate cancer screening, which consists of the PSA blood test and a digital rectal examination. There are certain people who are slightly higher risk for getting prostate cancer, such as those men who have a family history on their father's side. So if they have a father, a grandfather, an uncle, or a brother who's been diagnosed with prostate cancer, their risk is actually doubled. So we recommend men who have a family history to start getting screened either at 40 or as early as 40 or 45. African American men are also at increased risk for getting prostate cancer, and when African American men get prostate cancer, they have a higher chance of it being more advanced or dying from the disease. So we also recommend African Americans to start getting prostate cancer screening at an earlier age.
Also 40. Any African Americans?
Yes.
40, 45. That's wonderful. Now, how reliable are these screenings and how do they take place?
The blood test is probably the most sensitive test for diagnosing prostate cancer. A lot of people think just because a PSA is elevated that it means they have the disease, which is not true. The PSA blood test is really a risk measurement tool. And we decide whether to do a biopsy based on what the PSA is doing, if it's above what we consider a normal threshold or if it's rising at a certain rate, which we call the PSA velocity. The digital rectal examination is to feel the prostate gland to see if there are any hard nodules or lumps on the prostate. And if any of those combination of things are concerning, then we may recommend doing a biopsy. The only way to know if somebody has prostate cancer for sure is to do a biopsy.
Something that you mentioned too is this blood test, and I understand that it's very simple. It's a simple blood test that can be done. And while the prostate exam might be uncomfortable for some, the idea of being able to be aware of it early is so important.
Absolutely.
Well, are there certain things that men can do to prevent prostate cancer?
Well, there's no absolute perfect thing that you can do to prevent prostate cancer.
If there were absolute perfect things, my list would be
That's
long,
right.
and I would be focused.
There is some very compelling scientific evidence that certain vitamins and supplements reduce the risk of prostate cancer.
Any in particular?
Yes, there's actually 5 in particular, and those are vitamin E, vitamin D, selenium, which is a trace element, lycopene, which is a beta-carotene that comes from tomatoes, and soy, which has something in it called phytoestrogens. And those are actually the only vitamins and minerals and supplements that have been shown through scientific research to have a protective effect for prostate cancer. Also, a low-fat diet. High fat in the diet has been associated with prostate cancer as well as colon cancer and other malignancies. Yes.
So if you have a history of prostate cancer in your family, you might want to talk to your doctor and see if these supplements might be an option, and also make sure you keep your diet in check.
And we counsel men who are at high risk to consider taking these things. We refer to it as chemo prevention.
That leads me to ask you how prostate cancer is treated, because you mentioned chemo. I know that's one of the treatments available, but there's others as well.
Basically, when you have early stage prostate cancer and it's considered curable, there are 2 ways to cure prostate cancer, and that's with surgery to remove the entire prostate gland, and that's called a radical prostatectomy. And there's also 2 types of radiation that can treat prostate cancer. One is by implanting radioactive seeds directly into the prostate gland. That's also called brachytherapy. And you can also beam X-rays with a machine called a linear accelerator directly at the prostate gland, which is a completely non-invasive therapy, which we call external beam radiation therapy.
Any last words that you might say to any wives out there, sisters out there who are thinking about their loved ones right now?
Well, I'd certainly recommend that they encourage their loved ones to get annual checkups with their doctors, ask about getting a PSA blood test, and certainly eat healthy.
Thank you so much, Doctor. I appreciate you being here.
Thank you for having me.